Hi, I'm Dr. Steve Pearlstein, and I want to welcome you to the Facebook page for Primary Care Chiropractic Physicians. On this page, you will see a number of videos that we've made for you. The first set of videos that you're going to see helps you understand what we've been up to in New Mexico over the past 5-6 years. We introduced advanced practice legislation that has enabled chiropractors with additional education to prescribe certain medications, use injectables, homeopathics, natural substances. And we have a number of videos that will explain the process that happened and help you understand exactly what we did in New Mexico over the last number of years. There'll be another series of videos in which we help you understand what happened in New Mexico in 2011. We introduced a bill that the International Chiropractic Association opposed, and we're going to rebut them in a number of videos. So we want you to enjoy this Facebook page. We want you to tell your friends and colleagues about it. Let them know that they can look it up and like it, and we want to spread this message that chiropractic is more than just what some people think it is. Thanks. I'm Steve Pearlstein. I'm a chiropractor in New Mexico. I have been the expert witness on all of the advanced practice bills in New Mexico. I'm a past chair of the NMCA Political Action Committee, and with me is Dr. Robert Jones. We've worked together on the advanced practice bills, and I wanted to ask you, Rob, how did all this begin? How did it begin in New Mexico?
Well, it started for me about 13 years ago when I joined with an osteopath to form an integrative clinic. And in that integrative clinic there was medical doctors and osteopaths, nurse practitioners, physician assistants. And our goal was to have a team of providers to work for the best health care we can give our patients. During that time, our osteopath was doing a lot of homeopathic injections and doing injections for trigger points and neuromusculoskeletal injections that really were amazing to as an adjunct to the chiropractic adjustment. It became that he was so busy that it would take months for us to get a patient in to see him. And I was thinking, well, why can't we do this? Our law here states that we can do procedures by piercing the skin for diagnostic purposes, to draw blood, to analyze the blood, to analyze fluid in a joint. So the language said that we can administer natural substances. I wanted to know from the Board of Examiners, does administer mean that we can do that by injections for a therapeutic purpose, just like the osteopaths were doing? I asked that question of the board. That created quite a ripple within the Board of Examiners in the acupuncture board. And the chairman wrote a letter to the Attorney General saying that chiropractors were not very well educated, they're not an educated profession, and that we were going to be a danger to the public if we did this. The Attorney General said, hey, we need an opinion on this. And the assistant to the Attorney General, sitting on the Board of Examiners for the chiropractors, had to do some research. She came to the hearing and said, you know, you guys can't do this because only physicians can pierce the skin to be able to do these kind of procedures. And our chairman at the time said, well, then that's not a problem, we're physicians. And she said, no, you're not. And there was a huge silence in the area. What happened was, in 1936, we were asked as a profession to give vaccinations. When we declined that, it took away our privilege to be called physicians. So we asked, how do we get back into the Practice Acts to be called physicians? And she said we have to fit certain criteria, and that was to be part of the Drug and Cosmetic Act, to be part of the Pharmacy Act, and to be part of the Controlled Substance Act. Well, at that point in time, my concern was we cannot lose our physician status here in New Mexico. At that time, Steve, you were the chairman of the PAC, and I came and presented this problem and said, we need to do some legislation.
That was back in, say, 2006, I believe. We had a lot of good people on that PAC, and we started to look at the issue. We brought together some people to train us in how to go through the legislature, and then it just so happened that one of my patients is the Speaker of the House of Representatives, and he was very responsive and very supportive of what we were doing, and he agreed to sponsor the bill. It took a while to put it together, but we did, and one of the things that were crucial to getting the bill through was that we had meetings, the Political Action Committee had meetings with the New Mexico Medical Society, the New Mexico Medical Board, the Pharmacy Board, the Pharmacy Association. We kind of opened ourselves up to them. And it just so happened that, given the people who were on the boards at that time, they were open to the idea. They suggested certain things. We altered the bill. We went into the legislature with consensus and agreement that followed us through all the committees and through the House. And we didn't make it the first year of 2007, but we did in 2008. There was a technicality that created some difficulties in the bill that we attempted to correct in 2009. We got that through, both bills signed by the governor, who, that was another thing, we also solicited his support in years prior, and he said that if we could work with the medical board that he would sign the bill, and he was true to his word. So that's actually how, that's in a nutshell how it happened. There's a whole lot more details, but that's how it happened.